Hi, everyone. Welcome. My name is Corey Slack. I'm the Associate Director of Alumni Engagement, and I'm so excited that you are here tonight. Thank you so much for joining for what is, I believe, our 6th COVID-19 Speakers Series event. While I am talking, please feel free to take a look at our app that we have with the Alumni Association. You can use the QR code at the App Store, or you can just search CSU Alumni app in your app store and you can download it there. It is a free app. It holds a lot of our events and everything that's coming up, and other information too about membership and future events that are coming through with CSU. I understand that these are challenging times for many reasons, but we are so excited to have you here tonight, and we hope that this is a fun and educational webinar for all of you. We are here to build RAM community and be a resource, and we hope that this webinar is just one of the many ways that we could do that for you. Again, thank you so much for everybody participating tonight. One group of people that we would love to recognize are all of our members. Without members, we are not able to do events like this. So thank you so much for being members. We have around 12 members here tonight, and we're so excited that they are here. We also have around 6 lifetime members that are in attendance. So again, thank you for all of your membership and all of the support for the Alumni Association. While I am also talking, if you would like, you can go to your chat feature and you can change the "to" from all panelists to all panelists and attendees. And you could type in your name, where you're from, the year you graduated, and the college that you graduated from. It's always nice to just share the information of who's on and talk to other people and see where other RAMs are throughout the nation. We've had events where we've had RAMs all from Africa that logged in at some points in time too. So feel free to put your information in there and meet other RAMs that are here tonight too. I would also like to thank our partners for tonight. The first one is Women in Philanthropy, the Vice President of Research, as well as the College of Veterinary Medicine and Biomechanical Sciences. Without these 3 groups, we would not be able to put on this event. They help find the speakers and identify the right people to make sure that all of our events are possible for tonight. Just a reminder too, this is a webinar tonight, so we cannot see you or we cannot hear you. But if you would like, you can type stuff into the chat feature like questions. We also have a Q&A area, so if you want to ask questions there, we will be filtering all of the questions and then answering questions at the end of the presentation. And I will make sure to break out who was speaking when those questions were asked so that I know who we can talk to when we're answering those questions. Also, in just a few moments, I'm going to add a couple of information to the chat feature so everybody can see. One's going to be a technology thing. So if you have a technology issue, you can email me at corey.slack@colostate.edu, or you can call me on my cell. I'll post that in the chat in just a few moments, as well as just general information on what's going on and information about the Alumni Association too. And now I'm excited to introduce to you tonight's guest speakers. We have 3 of them tonight. We have Dr. Jessica Witt, we have Dr. Gaya Sivakumar, and then and Dr. Nicole Kelp. We are so thrilled to have these 3 here tonight. And without further ado, I'm sure you're all sick and tired of hearing me talk, and I will let Jessica take it away.
Okay, Jesse, I'm going to get our slides up and then we'll be good to go. Okay, is everybody able to see my slides?
Yeah, well, I can, so.
Yeah, you're good to go.
Okay, awesome.
All right, hi everyone. Thank you so much for coming. We are so excited to talk to you about our current research and our planned research. I'm Jessica Witt, and I'm going to be presenting with my team, Gaya and Nicole. You've probably heard in this series a lot about the science underlying COVID-19, things like how do we test for the disease, how do we track the disease, how does the disease spread, how do we develop vaccines for the disease. Another really important component for public health is getting the public to understand the science and understand the messages going on about how to how we should proceed in order to be healthier. And so this talk is going to be about how we can communicate about the uncertainty related to COVID-19, really about COVID-19 in general, but one of the hardest features about it relates to the uncertainty. And so this talk will be about the public side, the public comprehension and public communication of COVID-19. All right. So the reason why it's so important to do research on communicating about science is that a lot of science entails uncertainty, and the mind is bad at reasoning under uncertainty. The mind was not built to deal with uncertainty. People really struggle to make decisions when there is uncertainty. These struggles lead to lack of comprehension, confusion, anxiety. We see a lack of trust where when there's not an understanding of the science, the public then develops a mistrust of science and scientists. And then when there's not a good understanding or not good trust or just not clarity in the information, people don't want to take action, even if there is evidence supporting that action. And so for our team as scientists, what can we do to help bring uncertainty to the public in better ways? So I want to give you a few examples of the mind struggling with uncertainty. So imagine that you are given $50 and you have two choices. Option one is you keep $30 of it. And option two is you gamble with a 50-50 chance of keeping it or losing the entire 50. And so go ahead and take a minute and figure out which one you would pick. What studies show is that the majority of people will choose option one, that the majority of people in this gamble will pick the sure thing. All right, now let me give you another example. Imagine you're given $50 and you have two choices. Option one is you lose $20 of it, and option two is you can gamble with a 50-50 chance of keeping it or losing it. What do? Well, in these studies, we don't give them both, but in this case, the majority of people pick option two. So now people aren't going with the sure thing, they're going with the gamble. And if we put up both problems, you can see that actually they're exactly the same. In both cases, the sure thing, you leave with 30 and not with that 20. And in option two, there's a gamble where you have a 50-50 chance of keeping it all or losing it all, right? So why would these two options, these two framings, lead to different responses? Well, the reason is our mind doesn't deal well with uncertainty. And so we're prone to things like framing effects. We're prone to how the information is phrased. And so this just shows a little bit of the vulnerability of our mental states to things that contain uncertainty. Let me give you another example. So some of you who follow Nate Silver and in his blog 538 might remember that he seemed to convey a strong prediction that Hillary Clinton would win the 2016 presidential race. And for people like myself, I kind of thought it was in the bag. I kind of thought it was a sure thing that she would definitely win. And so I was so surprised to find out that she lost. And a lot of people were surprised, and people like me developed a mistrust for Nate Silver. I didn't really follow his election information anymore because I thought, oh, how could he be so wrong? Well, was he really so wrong, or did I misunderstand the information? Did I misunderstand the uncertainty? His response is, I think people shouldn't have been so surprised. We had him at a 30% chance, and that's a pretty likely occurrence. So where was the disconnect? Did I not pay attention to that 30%? Did I just encode it as it's a sure thing? And so this is just another example where the public struggles with uncertainty, and then there are consequences like mistrusting the source of the information later.
And then finally, another example that's really current is with the COVID vaccine and potential side effects. So a question that you might have seen floating around is, does the COVID vaccine cause Bell's palsy, which is a neurological condition where the facial nerves basically have partial paralysis and have some drooping on the side of the face? Well, here's the data that led people to consider this. The Pfizer vaccine, when looking at the trial data for people who got the Pfizer vaccine during the clinical trial, developed Bell's palsy. With the Moderna vaccine, it was similar. 3 people who received the vaccine in the clinical trial developed Bell's palsy, which could be really concerning. It is helpful to look at how many people were in those trials, and that's the percentages. We can see that that's actually a really small percent of the participants who received the vaccine in those trials. Yet that was still leading some people to think that there could be a causation between the vaccine and Bell's palsy. However, we need to look at, does Bell's palsy just develop normally in people? And in fact, it does. If we just look at the general population, 1 to 4 people per 10,000 will develop Bell's palsy in any given year. Bell's palsy is generally a temporary condition. And that's 0.01 to 0.04% of the population. So there's this range of kind of just background or baseline where Bell's palsy will develop for any number of reasons in a population. And you'll notice that in the vaccine trials, they were right at, if you round about that 0.01%, they were right within that range of what's normal. In fact, even a little lower. So there actually isn't any indication that the vaccine causes Bell's palsy or is even correlated with Bell's palsy, because just the normal population develops Bell's palsy within that range. But this can lead to some confusion when people see ranges or baseline. That information can tend to be ignored, and all we see is I got the vaccine and I also got Bell's palsy. There must have been a causation, even if that's not accurate. So for all of these reasons in general, we know that uncertainty can be a little problematic, and we in our research wanted to explore this a little bit more because we can't ignore uncertainty. There's all these bad reasons. It's hard for people to understand. It's confusing, but it's actually a necessary part of science. Science is inherently uncertain. So you can see I have here a graph. You'll notice there's error bars, there's different points. We never get everything landing at one thing. There's always ranges, or with any assay we do to measure anything, there's not perfection. There's always limitations of any given assay or any different experimental method. So we as scientists know that there's uncertainty and we can't ignore it. Secondly, a big issue with this, with COVID, is that the public has been brought into this scientific process more so than usual. So often there'll be a hypothesis, an experiment that's tested, some data or conclusions. We use the results to kind of make some interpretations and see whether it supports our hypothesis, et cetera. That's the scientific method. Scientists are comfortable with this. As data accumulates, we might change our previous conclusions or opinions based on new data. But generally, people who aren't part of that process don't see all that behind the scenes. But with COVID as this emerging disease, people were brought into the process. We couldn't just not tell people as it was going on. It was affecting lives, right? So the CDC did their best in communicating, the WHO, other scientists and organizations. A great example is before April 3rd, the CDC was not recommending that the general public wear masks because they didn't have data to support its efficacy. Obviously, as data was accumulated, they changed that recommendation because the preponderance of evidence was now pointing to the fact that the general public wearing masks was effective. And that wasn't because they were lying or hiding anything before. That was just the process was unfolding. That's how science works. But that can be sometimes hard if the public's not used to seeing it. Also, another good reason for uncertainty is because it helps explain possible outcomes with the science being inherently uncertain with this process. Say we have a range of possibilities. If option X happens or option Y happens, either within those range of possibilities, we can prepare for both option X and option Y. Or if something happens, we don't have to be surprised by it because we know that because there's uncertainty, there's ranges of possible outcomes, that those aren't surprising. Those can be within the realm of expected. And then finally, uncertainty can help build trust over time. Even if it can help decrease trust in the short term, if scientists continue to be transparent with their process, with the limitations of their research, with why there's evidence for changes to be made, that can help the public begin to trust science and scientists as they follow the process. So knowing all this holistically, we wanted to do a study to see how this worked within the COVID context. So Gaya and I did a study along with our labs. I had some undergraduate research assistants here at CSU, as well as a student in the Colorado School of Public Health working with me to analyze CDC communication, so the Centers for Disease Control and Prevention, and how they communicated via social media and how people responded to that. So the CDC would make posts about COVID-19. They posted 470 times about COVID between January and July of 2020, which was our study period. And of each of those posts, we use a method called content analysis to analyze the topic that they talked about, the purpose, the medium, meaning did they use words or infographic or video, whether they offered advice, did they provide evidence for their advice, and did they use a certain or uncertain tone. So this is an example of a post that had an uncertain tone. They use words like appears to have reduced, as opposed to mask use reduces COVID. They provide some qualifiers. This is in Kansas in a particular study set. And this is just an example. The science is inherently uncertain. There's ranges. They are qualifying their statements based on the evidence they have. We then looked at public response in two ways. One was engagement, so the number of reactions, which could be any of these you can see here. You can like a Facebook post, you can do the laughy face, the heart, the angry face, etc. So any of those reactions to a post, comments, and shares. So this is some quantitative data we were able to analyze. And then also some qualitative data. So we would look at the most relevant comments for each post and code them as either positive, negative, or neutral. Positive being they were supporting the CDC or the stance that was presented in that post. Negative being they were not supporting the CDC and the science or stance that was presented, or neutral was neither positive nor negative. So what were some of the results of this? One result was when the CDC provided advice on personal behavior, such as social distancing or masking, this did not lead to a positive response. That it was correlated with neutral and negative comments, but not positive comments, meaning that people did not like to be advised on what to do. And this might not be terribly surprising, but it shows evidence for when the science is emerging, like we talked about, and people are invited to an emerging scientific process, they don't want to take action based on that data because there's a lot of uncertainty involved. So this really lends evidence that we need to do more research on how to advise people on personal behaviors during emerging and uncertain scientific situations, so that people do take action as necessary and are willing to evolve or be flexible and adapt their actions based on new scientific information. Another result that was actually really surprising to us is when we coded for certain versus uncertain tone, the CDC used a certain tone 65% of the time and an uncertain tone 35% of the time. There was no difference in any form of engagement or responses in our statistical models. So we were a little surprised by that, but there's a possible explanation, and it could be that when people see COVID, they just think everything's uncertain, and they're not noticing the nuance of language that we as experts were parsing out. They just see COVID and everything's uncertain. And so obviously there's no difference depending on the nuance of those language between certain or uncertain tone. And to test this, we set up another experiment. What if we could change the words some more? What if we could really separate certain versus uncertain tone to more strongly convey uncertainty? Would that lead to a difference? So to test that, the group of the three of us actually have set up and developed a survey instrument that is in 3 parts. So in the first, we assess people's general attitudes. Do they trust science? Are they supportive of things like vaccination? What are their ideologies politically, religiously? What kind of beliefs and thoughts do they have? Since all of these have been shown in the literature that can affect how people interpret science communication. Then we give them what we call an intervention. They read something, either that is in certain language or uncertain language. And I'll show you that in a minute. And then after that intervention, everybody gets questions that measure comprehension, trust, and decision-making. So the comprehension, we both did self-rated, rate how much you understand this information. But we also used comprehension questions where we gave them different outcomes and ranked how much, what they thought of those outcomes. And this, I'll show you those outcomes, and it enables us to really closely analyze how well people are understanding the possible outcomes. We also asked them some questions using validated survey instruments to look at trust in the expertise of the science or the scientists that produce this information, and then decision making. Would they intend to get the vaccine based on reading this information? We've done a pilot study with 117 students here at Colorado State. Obviously, we know that's not a nationally representative population, and we're planning to do this with a nationally representative population, but we found some interesting results just from our pilot study so far. So we'll share those with you. First, I'm going to highlight this in this middle section, what communication we gave them, so you can see that. And then I will highlight what those different outcomes are, so you can see that as well. So here's the communication. People who took the survey saw one or the other of these. So the first was certain language, and they read this paragraph. The COVID vaccine prepares your immune system to recognize and fight the COVID virus. 2 COVID vaccine candidates are shown to be 95% effective at preventing COVID infection entirely and 100% effective at preventing severe COVID. Immunity to COVID from the vaccine is long lasting. Versus others read the uncertain. And you'll notice here I've highlighted in the bold and underlined the differences. So instead of the COVID vaccine prepares your immune system, the COVID vaccine is supposed to prepare. Instead of are shown to be, we have promising preliminary data has emerged from clinical trials. And then from stating, we are certain that this is long lasting, we said more studies are needed to confirm whether the vaccine is effective and whether the immunity is long lasting. And that's a more nuanced and accurate assessment of the science. Like we said, science is inherently uncertain. And so the uncertain one is more accurate scientifically and appreciates the nuances better. And so after people read this, they were then asked to self-rate their comprehension, but also to rate their comprehension by assessing possible outcomes. And the 4 outcomes we gave them were this. So scenario 1, someone gets COVID, that person recovers and then is reinfected. Scenario 2, Mary here gets the vaccine, gets exposed to COVID and does not contract COVID. Scenario 3, Alex gets the vaccine, is exposed to COVID and contracts COVID, but doesn't have any symptoms. And then scenario 4, Tran gets the vaccine, is exposed to COVID, Tran gets COVID from that exposure and almost dies from COVID, has very severe COVID. So we had them rank their, how surprised are you by this outcome? And the reason surprise is a proxy for us to measure understanding is if an outcome is slightly likely and someone is very surprised by a slightly likely thing versus something that's very likely, they would probably be less surprised by that. That would mean they really understand it versus someone, for example, say something is a very unlikely or very just barely slightly likely, and they're not surprised at all by this very rare instance that probably won't happen. That means they probably don't understand the information very well. So for each of these 4 scenarios, we had set up, here's how likely this would happen. So then we can see different people, how do they respond to these scenarios? And do they truly appreciate the nuance of how the COVID vaccine might work based on the information we gave them?
Actually, Nicole, can you go back, please?
Yes.
Yeah, the scenario we were mostly interested in was scenario 3. So in scenario 2, the vaccine works, and we would expect people to not be surprised by this. In scenario 4, the vaccine did not work at all, and we expected everyone to be surprised by this. So scenario 3 is really our critical condition where, you know, the vaccine's it's supposed to prevent you from getting it, but there's some wiggle room there. So if someone has the vaccine and still gets COVID, but only has a mild case, like, well, that is in the realm of possibilities. So what we're really interested in is the surprise for that scenario. So here are the results. In the certain condition, the participants who were assigned to that certain condition, they self-reported that they understood the information better. But they did worse at understanding the expected outcomes, particularly on that critical trial. compared to the uncertain condition where they self-reported they did not understand the information, but in fact they did, because they had better understanding of these less likely but still possible outcomes. So we really see the difference kind of on the edges of what's expected, where it's going to happen, it's just not going to happen as frequently. And so what we find from this, and I also should say that you can imagine what happens if you have this very narrow view of how the vaccine should work, and then it doesn't always work that way. And what's the consequence when that happens, right? One of the consequences is you lose trust. You lose trust in science, you lose trust in scientists. And so by being able to accurately convey the realm of possibilities, we also hope that this will help build trust over time, where if someone gets the vaccine and then still gets sick, they know, well, yeah, it's not supposed to happen a lot, but it is supposed to happen. And so the findings here are that we have this barrier in terms of getting people to feel good about their understanding, but we've achieved greater true understanding by using this uncertain language and communicating the realm of possibilities more fully. And we think that over time, that's going to help build trust. All right, so uncertainty in science, right? There are benefits to conveying the uncertainty. First of all, it's a true reflection of science. We want to be open and honest with the public about science, about scientific advancements. And by conveying the uncertainty, we also get a better understanding of the possible outcomes, and that can help build trust over time. So there's enormous benefits to conveying the uncertainty, but then there are these problems we need to solve, like failures to understand, the short-term loss of trust, decreased motivation to act. And so what can we do to embrace all the benefits of conveying uncertainty and yet downplay and reduce all the problems with uncertainty? And so our team is working on finding solutions so that we can accurately communicate about science more fully. All right, so one of our solutions is to have better visualizations. I'm a vision scientist, and so I might be a little biased here, but I think that the visual processing in the brain are among the most powerful processors that exist. Visual processes, they're fast, they're efficient, they're effective, they're effortless. They happen automatically. More than 50% of the brain is involved in visual processing. And so why not try to get more of the brain on task? Why not try to present any information in a way that harnesses the power of the visual system? So we want to present data visually, but there's a problem with doing that because for some people love graphs like myself, other people, they don't really like data. They don't find it engaging or immersive. And so how can we present the data visually and also have it be engaging? And so the solution is to use better visualizations. And so one of the great visualizations that came out during coronavirus was created by Harry Stevens at the Washington Post. This is actually the most viewed article on the Washington Post website. And Nicole, if you could go to the website, please. All right, so here's the website. I'm having her scroll quickly just to show you the key visualization. So what you're seeing is an example of how coronavirus transmits in these scenarios. So if you can, yeah, a blue dot is a healthy person, an orange dot is a sick person. When a sick person comes into contact with a healthy person, that healthy person becomes sick too, as demonstrated by them becoming orange. All right, so now that you know how it works, let's look at the simulations. So here's a simulation where you have a town of 200 people moving around pretty randomly. And again, the blue people are healthy, the orange people are sick. When a sick person comes in contact with a healthy person, that healthy person gets sick. In this simulation, everyone recovers, and when they recover, they become pink. And what you maybe were able to see is how fast the disease spread, how quickly everyone got sick. Can you play it again, please?
Yep.
And so just look at how fast this disease is spreading. And of course, we know it spreads quickly. That's why we need such extreme measures, is to slow the spread. You've probably heard flatten the curve, right? And so how do we flatten the curve? Well, one way to flatten the curve is social distancing. Yeah, let's skip that one. So in this simulation, 75% of the population is social distancing, which in the simulation means they are literally staying in place. A sick person can still infect them if the sick person comes to their place, to their personal space. But you can just see how much slower the spread is in this scenario. That by social distancing, it has a huge impact on the rate of infections. And so what we did in our study was we had people come to this website and watch these simulations. So that was one group of participants. And the other group of participants, we just showed them the outcomes. We just showed them the outcomes related to the different attempts to flatten the curve. So the histograms on the left, the first one was a free-for-all. That was the one you first saw. I didn't show you the attempted quarantine. I showed you the moderate distancing, where 75% of the population engages in distancing, social distancing. And so we just showed the participants these outcomes. And there's information in these outcomes. You know, moderate distancing works to flatten the curve. Extensive distancing flattens it even more. And so the question for this was, by showing the visualization of how the disease spreads and how social distancing can slow that spread, can that help get people to understand the information and the uncertainty? And what we found was that yes, it does. So by showing how, seeing these simulations led people to have a greater understanding that social distancing reduces the rates. These participants had a greater intention to engage in social distancing. That specific study was run last March or April, so kind of at the beginning of the pandemic. And yes, seeing the simulations increased intentions to social distance compared to just seeing the outcomes. And also people just have better attitudes towards social distancing. And so we see that using these better visualizations, we can have a better communication of the information related to COVID-19, such as preventative techniques we can use to slow the spread. All right, another study we've recently run looked at how to convey information related to the risk of exposing oneself to someone who is sick at Thanksgiving. So lots of people traveled at Thanksgiving. There was a lot of concern about what would happen to COVID spread. And so we as scientists, we kind of took advantage of this to try to figure out what's the best way to convey this information. So in one group of participants, we just showed them this data, the data only, we just showed them this bar graph. And this is your risk of running into a coronavirus positive person at a 10-person Thanksgiving dinner if you only dine with members of your own household, which is 0%, or if you have dinner with extended family and friends, or if you have dinner with random people, and those are the same, your risk is the same. And in both cases, the risk was 40%. And then we contrasted that condition to this other condition we call the data walkthrough. And in the data walkthrough, we don't just throw the numbers at them, we walk them through how those numbers are calculated. We show them the steps that it takes to go from 4% of the population, 4 out of 100 people being positive, to a big Thanksgiving dinner, to 40% of people being exposed. And so this slide on the right is just one of the images we showed, but we showed them a whole series of images. And what we did in this study is we asked them how concerned they were before and after. And what we found was that for the people that just saw the data, they actually had decreased concern. And these are participants who had planned to spend Thanksgiving with other people, and they had less concern after seeing the data. And so we call this the backfire effect, where you think, oh, I'll give them the data, and that'll help them understand the risks. And actually, it didn't help them understand the risks, and it backfired, and they were less concerned. In contrast, when we walked them through the data, we saw an increase in concern. And so we can use these better visualizations to help get people to understand these complicated issues.
Okay, so the second solution that we are offering is kind of related to solution one. Both of them showcase the effectiveness of visual forms of communication. So we suggest the use of videos as a message format whenever possible. So let's go back to the study, the content analysis study that Nicole and I worked on about CDC communication practices about COVID-19 via Facebook. What we found is that CDC used videos as a message format rather sparingly, only 16% of the time. So as the pie chart shows us, print messages was the most preferred message format, followed by infographics. The thing is, even though videos were very sparingly used by the CDC, they received more engagement from the Facebook audience. And to refresh your memory, we measured engagement in forms of reaction, comments, and shares. So even though, so as the bar graph will show you, video messages compared to other formats received more engagement. They received as much as 10 times more reaction, 4 times more comments, and 6 times more shares. Okay, so video messages do have the ability to retain audience attention for a longer period of time. So it makes a lot of sense for us to use this particular message format as a way to explain uncertain data to a non-expert audience. Okay, moving on to the third solution that we are offering, that is to provide audience with consistent message from experts and opinion leaders. So in human society, consistency is highly valued, right? And there is some support that for the claim that consistent advice from multiple sources actually leads to increased confidence in the advice offered. So the study that I conducted with my fellow researchers from JMC department, Dr. Ashley Anderson and Kibam Young, examined if consistent advice would still be valued during COVID-19 times where political orientation has started to muddle the field. So the research question for our study was, how does messaging affect decisions to wear face mask? Now, before we talk about the study design, there's something that I want to point out is that this study was conducted towards the end of April and beginning of May. And during that time, people had just started talking about, wearing face mask, and the political ideology, polarization of people's opinion along the political ideologies were not yet settled. Okay, so we designed this experimental condition where participants were assigned to one of the two conditions. The first condition was the consistent condition, the other one was the inconsistent condition. So participants assigned to the consistent condition were asked to read a news article where both CDC and President Trump had very similar advice about face mask. They both suggested that wearing face mask was desirable because it would reduce infection. In the other inconsistent condition, participants read a news article where it was written that CDC is advising the public to wear face masks to reduce infection. And President Trump, when interviewed, also stated that, yes, the US government is going to go ahead and suggest that people wear face masks, but he made a point that he personally was not going to wear one. So after reading this article, participants were asked to rate their confidence and trust in CDC's advice. So we conducted, we gathered data and we analyzed the data, and this is what we found. We found that political orientation mattered. So participants in consistent condition who had high level of trust in White House, which we read as trust in President Trump, displayed an increased trust in CDC advice after reading the article, where it showed that both President Trump and CDC were very consistent in the advice that they offered. Whereas there was no change in trust for participants who had lower degree of trust in the White House. For participants who were exposed to the inconsistent condition, high degree of trust in the White House led to a reduction of trust in CDC advice after exposure to the news article, where you could see that President Trump and CDC were diverging a little bit from the kind of advice that they were offering. Again, for people who had low degree of trust in White House to start out with, the lack of consistency between President Trump and CDC didn't have much of an impact. Okay, so the results of the study shows us that yes, consistency matters. It can be a powerful tool, but it's also important to tailor the message strategy depending on your audience's political ideology. So for example, for a Republican audience, it makes sense to construct a message where the CDC and a trusted opinion leader from the Republican side, like President Trump, both offer consistent message. And for Democrats, maybe exposure to a message where the CDC and their trusted opinion leader, like say President Biden, are offering consistent message.
So those are just three of the example solutions we're offering. This is a really hard problem. Like we said in the beginning, the mind just doesn't like to deal with uncertainty. We want to resolve uncertainty. Many of us don't have a high tolerance for uncertainty. And so we're really excited to do some work to try to solve this really important problem in science communication. And we're working on developing a project right now where we're looking at a few different factors. So we're looking at the communicator, the format, and the audience. So for the communicator, there are things like, is it a scientist, an expert, or a politician? For the format, we're going to do work with visualizations and the language, the framing. And then the audience, things like their prior beliefs and ideologies. And there's been a lot of work on these individual pieces. And what's unique about what our team's going to do is look at the intersection between these and how different people respond to and understand uncertainty in science, depending on who's communicating it, what's the format, and what are their prior beliefs. And so how do these things intersect? And our critical outcomes are things like comprehension. Do they understand the information? Do they trust it? Do they have ongoing trust? Is it anxiety provoking? Like we said, having uncertainty provokes anxiety. And so how can we convey the information in a way that people understand it and don't feel anxious about it? And then, of course, we want people to take actions that will enhance public health. So the three of us are actually working on a grant right now that we're submitting to NSF in the next month, and some other funding that we currently have and are pending. And we're just really excited to hopefully have a really positive impact in bringing science to the public in ways that the public can really benefit from the full aspects that science has to offer.
And with that, I will stop our share so that we can take whatever questions you guys have.
I haven't received any questions yet, which usually means that you guys covered everything that you wanted to cover perfectly.
Well, while we wait for questions, I think I'll add something, which is that this understanding uncertainty is not specific to the public. Scientists and experts also have a lot of trouble understanding uncertainty too. So it's a really hard problem. There's not going to be easy solutions. Things like consistency, engagement, maybe through videos or data walkthroughs, visualizing it. These are all things that are hopefully going to help. But it's a hard problem. It's going to take a lot of work to really figure out how to bring science to not just the public even, but to other experts too, because uncertainty, the mind just does not like uncertainty. It turns out the visual system is great with uncertainty. Your visual system knows how to use uncertainty and can perceive it. It's really good with it. Your action system is good with it too. But those kind of higher level cognitive processes like thinking and reasoning and decision making, those are the ones that really fail under uncertain conditions. And so how can we harness these other mental processes in order to get people to think better with uncertainty?
Yeah, and I'll build on what Jesse said about experts struggle with this too. And I think experts of different disciplines especially use different maybe statistical ways of conveying uncertainty or words to convey uncertainty. And so with problems like COVID, we need microbiologists obviously are important, but we need economists and public health and healthcare clinical people. We need all sorts of different disciplines to work on these problems. And so, yeah, helping different experts of different disciplines speak between themselves when they have different ways of conveying uncertainty or understanding it is also really important. So both the whatever ideologies, prior beliefs of that individual, but also the language of their discipline is relevant. I see a chat came up. Cultural framework also needs to be taken into consideration, age, language, history, gender, etc. Absolutely. So in these survey experiments that Gaya and Jesse and I are doing, we do collect those demographic factors. And as we get bigger sample sizes and a more nationally representative population, then the pilot study we had, that will be factors we take into account and see, is that one of the aspects in those intersecting factors, those person-specific factors of either the communicator or the audience that we will be taking into considerations.
One more thing I would want to add is that we also need to be aware of the cultural framework of the, message source, even the experts, right? We all come from different kind of, cultural frameworks. We are trained in a certain way, so our brain thinks in a certain way, and therefore we tend to design messages which makes most sense for us, which is not a bad thing. It's just, but we need to be conscious, and especially be conscious when maybe the cultural framework of the audience and the message source don't really match.
Ooh, someone put in a comment, the technology might not be as accessible across the generations. And I think that's absolutely true. I honestly found it really surprising when our data showed the effect that videos had. Like, it was tenfold. That is a really high magnitude in our type of work. And personally, I would much rather read something than watch a video. But that could be me with my personal background, with my field, with age. All sorts of factors could affect that. And so, yeah, creating different, maybe for younger teenagers or whatever, creating snippets in their 30-second TikTok videos or whatever it is to communicate versus something that matches other generations. Absolutely. So age could definitely be a factor. Okay, Laura asked, where does fear and expert casting doubt fit in? I don't think things are easy to understand for the fearful.
Yeah, we know that that fear confounds everything. And if your mind isn't working well with uncertainty and then you add fear to that, it's just going to impair it even more. Your expression about experts casting doubt, right? Like, you can, science has this uncertainty, and by framing it as experts casting doubt, I think it's kind of doing as a service to what you should expect from science, that science is not going to give you that pinpoint estimate. We showed those little bar graphs with the dots and the error bars. Like, science cannot pinpoint an exact value. One of my favorite examples of this comes from physics, where they tried to estimate the speed of light. And the estimates over time didn't even fall within the error bars from earlier estimates. I mean, there was just so much uncertainty. And we think of the speed of light. Well, there's a speed of light and we've measured it, but actually over time, that estimate of speed of light has changed dramatically. And so there's just so much uncertainty in science. And experts should cast doubt in the sense of saying, like, no, it's not well known, it's not certain. You could get the vaccine and still get COVID again. And it's just, the hope is that, the data are showing that if you do, it'll be a mild case. So in that sense, it's good for the experts to, so to speak, cast doubt by really just communicating all the realm of possible outcomes.
And Gaya, were you going to say something?
Yeah, I was about to say that, especially when people are being fearful, communications theories suggest that people are not going to be able to process the information in an elaborate manner, right? Like, they're not going to be able to reason through as much as when, like, the fear is not overwhelming them. So in those cases, then what people tend to do is, like, kind of depend on shortcuts, right? And having experts whom they trust say that, no, this message is really good. It's really actually, is stating the problem as clearly as it actually exists, really is very helpful. And in those cases, when they start casting doubts in a way in which you're taking away, it's going to add on to the negative effects a lot more. So that's something that all the experts need to be careful about. It's not to say that you cannot have a different opinion, but be careful about the way in which you're framing it.
Somebody asked, when people creating marketing or educational campaigns, do they look at our data and studies, i.e. a student campaign to overcome myths of taking the vaccine? Ideally, obviously, that people creating these campaigns are not just our studies, but looking at the literature so that they have an evidence-based recommendation for how to do these things. So they're not reinventing the wheel and doing things that we know won't work as effectively. So obviously, we as scientists, when we create our literature, we're talking about effect sizes and logistic regressions, and we're not creating it easy for someone who wants to create an educational campaign. So that's also, how do we explain the data in a way that is really applicable and usable? As a scientific community, those of us who study science communication, that's really something we can continue to do so that people can make evidence-based campaigns based on our and all sorts of other studies in the literature. Gaya and Jesse, would you add anything to that?
Jesse, you want to go ahead first?
Well, I was going to say, I think it's so important for researchers like ourselves to make the message easy to digest and have clear recommendations. So for example, the engagement via video, those are just such big effects. That's easy to communicate. But our goal in our research project is to come up with an outline of recommendations that marketing and education campaigns can use to help them frame their message better. And one of the techniques I've seen used that I personally really like is kind of what is the recommendation, how big is the effect likely to be, and then how strong is the evidence for it. And that those three pieces of information, and you can convey them in a pretty categorical way, like, 3 stars out of 5 or something. You don't have to get down to the level of precision that scientists will do in their scientific reports. But when we can put out, hopefully, a list of a framework or a list of recommendations that anybody can use when communicating to the public or even to each other, of what's the best way to present it so that the mind can comprehend what you're saying.
I just want to add on, like, traditionally speaking, as researchers and academicians, we tend to publish all our results in, journals, which probably a lot of people making marketing material are not really looking at, right? But I know that, like, recently, and we have had a lot of, the academic community is thinking about using other mediums to, kind of disseminate the kind of information that we find from research. So it becomes really important for scientists also to have a conversation going on with the general public. So it's not just, you're not just publishing in all of these specialty journals, but you're also reaching out. Maybe you have a Twitter page, or you are engaging with people with social media, or you're working with, your local newspaper and telling them, like, what great information you have found from your research, and kind of publishing it in a place where everyone can have access to it.
Yeah, absolutely. And I'll add in addition, we obviously are researchers of science communication. There's a lot of people who are practitioners of science communication. So they would call themselves science communicators. They're going to be the ones making these kind of campaigns. Having more interaction between the researchers of science communication and the practitioners, like Jesse and Gaya said, with us making our recommendations easy for them to use, is something that a lot of us are working on and hoping to increase. So we as a scientist can talk directly to the public, but there's people who are great at making videos. They have the shows, they have the Twitter followings. How do we help empower those people who have the audience to know the best ways to communicate about really tricky things like uncertainty? There's a question in the Q&A as well. As the chat. What do you believe will be the best medium going forward to educate on this or similar issues, especially considering current challenges with social media, as it can be an echo chamber where people get stuck? Yeah.
Oh, it's such a great question. I mean, I wish we had the answers. We hope to get them. There's a couple of things. So certainly a visual component is going to be important. Be it in, what happened to the question?
It went to the answered, sorry.
Visualizations like a data walkthrough, or the videos, for example. So certainly there's going to be some kind of visual component. One of the things that we've been really interested in is, so we know that personal narratives have a lot of power, and it's kind of the opposite of data. It's like this one storyline, but they're engaging and they just have so much sway. And so that's an area I'm really interested in attacking, is like, how can we make data more like these narratives? Like, what aspect of these narratives really grab you? And so, for example, there's a lot of stories right now in the news about how these vaccines are leading to negative side effects and negative outcomes. And these stories are going to have more impact than showing the data that there's a lot of positive outcomes. And so just kind of wrestling with, how can we make data more like these powerful stories? And the problem with the stories, if you could turn data into a story, that'd be great, but you can't, right? That's the whole point of this uncertainty, is there's not one storyline, there's not one outcome. People are going to get the vaccine and still get COVID. And so you can't tell a story to convey all the data. And so it's really a huge challenge. But I think our talk is really focusing on the visualizations and consistency. And also, a lot of people, there really just hasn't been research done in the way that we're framing it in terms of this intersectionality. And so hopefully something will emerge in terms of there are some universal ways to speak to everybody about everything that emerged from that.
And I'll add some of the other work that I do is more on the science education side, and specifically educating people in kind of the stuff that we do our research on here. So I have some projects with our lab working on training STEM students at CSU in science communication techniques. So our future scientists, how can they learn how to connect with their audience, but also training just everyone in science communication. I'm definitely really passionate about the what's called a dialogue model of science communication, that whenever anyone's talking about science, it is science communication. So that could be you and your grandma talking about it, and neither of you are scientists, but you were talking about science, and thus you were being science communicators in that moment. So how do we empower those to be more productive, more evidence-based and scientifically informed conversations? Because those are the powerful narratives, like Jesse said. So one project our lab is doing is in collaboration with CSU Extension, working with K-12 students, and we're developing educational activities to teach students about science literacy and science communication. And so a fifth grader, they don't know if they're going to become a scientist or not, but if they go to an after-school program and do an activity where they think about the scientific process and how it's communicated, then when they see stuff on social media and realize, hey, that's communicating in a way that's actually not accurately talking about science, giving them some of that science literacy skills, they'll be able to interpret things better, point out inconsistencies, and be powerfully effective and influential to their friends and families. So we're developing those activities now, and they'll hopefully in the fall, COVID's a little bit better, and so we can start getting into the classrooms with the kids to implement some of these. And we're starting with elementary kids, and hopefully we'll develop things up to high school level, and then obviously at the college level as well. But helping just train the general population in science literacy and science communication, so they can kind of get behind the curtain a little bit and understand how science happens and how to talk about and how to interpret the results. So there's less of the barrier between the scientists and the non-scientists. Trying to really help people understand it a little bit better, I think, is also a component that will help decrease these echo chambers of anti-science rhetoric that get kind of caught on social media and other places.
Yeah, and with that, I think we answered, or I think you all answered all the questions that were thrown out. So on that note, we could go ahead and end for the night. If you guys want to see this presentation again, we will have this up on our YouTube channel. I will send that out in a survey email coming out in the next few days for everybody. Again, Jessica, Nicole, Gaya, thank you so much for doing this. This is huge. And I know that I learned a lot. So hopefully everybody else that was here learned just as much too. So thank you so much. And thank you everybody again for being here, and go Rams.
Thank you.
Thank you all. Bye.
Bye.